I'm Dr. Matthew McNutt, orthodontist. Thank you for visiting our before and after page. We're going to discuss why an orthodontist might prescribe the extraction of permanent teeth in order to take a patient who has crooked teeth or an improper bite and straighten the teeth, make the smile beautiful, and help the bite come together properly. The most common reason for a patient to visit an orthodontist is because they have crooked or malaligned teeth. As you see in this example, these lower front teeth are very crowded, and the patient is going to ask the orthodontist to please straighten these teeth so that they can be easier to clean, or perhaps to look better, or to enhance the smile. There are a variety of reasons that a patient will visit us and ask us to help straighten their teeth. If you look carefully at the cases that we have on our extraction of permanent teeth page and on our non-extraction of permanent teeth page, you may see that some patients have a similar amount of crowding. And the logical question comes up, why would you prescribe extraction in one case and not in another? And the answer to that is really not very simple. We have to look very carefully at lots of different factors. If all we look at are the teeth in isolation, we could pretty much come up with a standard treatment plan for any amount of crowding. However, teeth are in individual faces. Everyone is different. We have to look carefully at how much supporting gum tissue there is around the teeth. Is it good, strong gum tissue? How much bone supports the root of the tooth? Each and every tooth has to be evaluated carefully. We have to look at how the jaws function, how they relate to one another, and we have to look at the smile very carefully and what we call the soft tissue paradigm. We're looking at lip fullness for patients, youthful appearance. We're looking at how the front teeth come together. It really is amazing how many different factors your orthodontist looks at very carefully just to come to the conclusion of what's going to be best for each individual patient. So it may be that a patient who has moderate crowding and very thin gum tissues and the jaws are not very supportive, it might be best for them to have some permanent teeth extracted. Conversely, you might see the same amount of crowding or perhaps even a little bit more, and we might have very good support of all of the roots of the teeth, great strong gum tissue, and no other issues with the bite. And we conclude that perhaps not taking out permanent teeth will be a very good idea. When we do prescribe the removal of permanent teeth, one of the first questions that often comes to mind for our young patients is, am I going to have a gap between my teeth? Where will all this space go after the braces are done? Well, what's interesting is, once those permanent teeth are removed and the braces or Invisalign are used to line the teeth up, the space that's created by removing the permanent tooth just slowly disappears over time because as the teeth align, they take that space up. So let's give you an example here. You're looking at lower teeth, and we're going to magically remove the lower first premolars, line the teeth up, and as you can see, once the teeth are in their proper spot and relationship, there's no space left over. Let's look at a similar illustration for the upper teeth, where the first premolars are removed and everything is lined up properly. The removal of permanent teeth in orthodontic treatment is sometimes controversial, and it can be confusing for patients who sometimes are exposed to marketing and advertising that seems to imply that if a particular type of braces are used, that it really eliminates the need altogether to extract teeth. Whether or not permanent teeth are removed really should not depend on what type of braces are used or what type of philosophy is used. It really boils down to what is best for a patient. The reality is, any amount of crowding, it could be extremely severe. As an orthodontist, I can put braces on those teeth and I can straighten them. But I want to treatment plan what is best for my patients for the rest of their life. I'm thinking about the health of their gum tissues. I'm thinking about the bone that supports the root of the teeth, how their smile looks, how the teeth function together. And if it's not going to be good for one of my own children, I'm not going to prescribe it for yours. I look very carefully to see what is best. I hope this answers some of your questions regarding extraction of permanent teeth combined with orthodontic treatment. Please take a look at the many cases that we have on our before and after page. We have wonderful patients who've worked hard with us to create beautiful smiles that last a lifetime, with healthy gums and jaws that work together properly, and everything in harmony. It really is a great opportunity whenever we get to change a smile for one of our patients.